Hi everyone, Dinesh Sirasena here, and today we're going to be talking about imaging the Achilles tendon. As with my previous talks, I recommend the ESSR guidelines for musculoskeletal imaging, and in this situation I recommend the ankle guidelines. It's got a very good outline on how to approach the imaging as well as what to expect when you are undertaking the scanning. And these are the images from the ESSR guidelines. So with the patient in a prone position with their foot over the edge of the bed, you can assess the Achilles tendon in both a long and short axis orientation. For the long axis orientation, the image here is a panoramic view, and you can see the tendon stretching from the muscular tendinous junction down to the calcaneum insertion. In the short axis orientation, it's important to try and see both the medial and lateral border of the Achilles tendon in the same view. And if you can't, you need to take the transducer from medial to lateral to make sure you scan the Achilles tendon in its entirety. In practice, this is how I would position the patient. So, having them prone with their feet hanging off the edge of the bed. For their comfort, you may consider putting a rolled towel between the dorsal aspect of the ankle and the examination couch. In this position as well, it's easier to manipulate the ankle into a plantar or dorsiflex position to assess the Achilles more fully. And this is how I would undertake the scanning. Using a linear transducer or a hockey stick transducer for better resolution, you scan the tendon in both a short and long axis orientation. It's possible to guide the transducer a little bit better if you place your ring and little finger against the transducer while you're scanning proximal to distal or medial to lateral, and this will hopefully give you better quality images when you're undertaking the imaging. And this is what you should see on the ultrasound. In the long axis orientation, you should see the calcaneum with the Achilles tendon coming and attaching on, and you should be able to scan from distal to proximal to assess the Achilles tendon in its entirety. Remember, even in this orientation, you should scan from medial to lateral as well to see if there's any significant long axis orientation pathologies. In the short axis orientation, as I mentioned previously, it's important to see both the medial and lateral border of the Achilles tendon. If you can't see it in one view, then you need to take the transducer medial or lateral according to your orientation and assess the border of this tendon. Even in the short axis orientation, it's useful to scan from proximal to distal or vice versa to assess the Achilles as fully as possible. In both situations, it may be useful to apply the power Doppler to identify if there is any evidence of neovascularity. Thanks for watching. I hope you found the video informative and it adds to your knowledge of musculoskeletal ultrasound imaging and interventions. If you did, please remember to hit the like down below and subscribe to the channel for further updates. You can follow me on Twitter, Instagram and TikTok. And remember to check out sportsmedinfo.sg. Thanks again, and I hope to see you soon.